Hello, everybody. My name is Guido Entenberg. I'm part of Wysa. Wysa is a digital mental health company. Specifically, we use artificial intelligence to provide mental health care. And today I am going to tell you about the development of the first version of Wysa in Spanish. So I will share my screen and we're going to start the presentation. Well, to start, I want to start by telling you briefly about Wysa, what our mission is, and what kind of products and services we offer. As I said at the beginning, Wysa's mission is to offer mental health support on a large scale. We use digital resources to help people gain equitable access to the most appropriate level of mental health care. For that reason, the solutions we develop at Wysa address the full spectrum of mental health needs. This includes primary care, but also wellness and crisis care. Wysa offers mental health care through a suite of digital solutions. The main and probably the best known is a chatbot based on artificial intelligence and trained by professionals from different disciplines, psychology, engineer, and also design, to have therapeutic conversations with people. People can chat with Wysa through an app or in web mode, but they also have access to other services and products. For example, they can find mindfulness audio exercises in the app or psychoeducational videos. All content included in Wysa is evidence-based. Through the conversations, people can do exercises from cognitive behavioral therapy or from other therapeutic techniques, such as acceptance and commitment therapy or dialectical behavioral therapy. Among the main advantages of Wysa is the possibility to offer therapeutic listening and alliance. This is an advantage in relation to other digital mental health tools. In addition, Wysa is trained to identify situations of risk or report abuse or trauma and offer personalized care pathways. Among its main opportunities, it is available full-time and offer a safe space to talk. This makes it Wysa a great resource for people who do not feel safe talking about their problems with other people. Today I'm here to talk about Wysa in Spanish, but first I think it is important to share some of Wysa achievements to date in English, as it is the basis on which this new version is being developed. Wysa in English has been implemented for several years. More than 4 million people have had more than 485 million conversations. Wysa has been used by people in 65 countries, and while this is a smaller number, it is not less important as it has helped prevent almost 200 suicides. Wysa has also worked with more than 30 organizations to date, including public health systems like NHS, global companies, and prestigious universities like, for example, Harvard. As for the Spanish version, we started working on it in 2021 and we continue to do so today. When starting the development of Wysa in Spanish, the goal was to develop a minimum viable product, MVP, since it was the first time that Wysa was going to start understanding and speaking another language. We consider important to start by training a specific set of artificial intelligence model and develop a specific number of exercises, do a first control test with users, and based on the results of this first implementation, move toward a more complex product. During 2021, we trained the first models and adapt a number of exercises that were already part of Wysa in English. These included conversations based on CBT, mindfulness exercises, sleep stories, and conversations to assist people who were experiencing a crisis. In addition, the Spanish language has the particularity of being very gender specific, so we incorporated, unlike the English version, a first conversation during onboarding in which Wysa asks people if they want to be referred to as male, female, or non-binary gender. And we incorporated in the app and tested the helplines of all the countries in which the MVP would be available to ensure clinical safety. Finally, we also decided which type of Spanish we wanted to use, as each Spanish-speaking country has its own style of Spanish. However, there is a so-called neutral Spanish, which is mainly used, for example, in television series or films, and which can be understood in several Spanish-speaking countries. This type of Spanish neutralizes local idioms and is therefore easy to understand for the majority. The development process was complex and followed the same requirements and steps that all Wysa conversations in English follow. This involved testing from a functional, conversational, and clinical point of view. Finally, in February 2022, we launched the MVP. I will now tell you about some specific aspects of the launch of the MVP in Spanish. First of all, the content became available to those users who had already downloaded Wysa before or who downloaded the English version during the last few months. In other words, we did not develop a new app. Anyone living in one of the 10 countries where Wysa in Spanish was launched, when opening the app in English, will find in the home a card inviting them to try the MVP. The number of exercises offered was 19, as I said before. The models proved to work well, very well indeed. At the end of each conversation in Spanish, Wysa asked people for quantitative and qualitative feedback. 70% of the people that talked to Wysa and gave feedback said that they felt understood by Wysa and found the exercises useful. And on a qualitative level, I will show you now some of the most frequent comments. Users mainly say that Wysa helped them to express things they had inside themselves and could not talk to anyone else. Also, Wysa, they said, helped them to relax, to reflect on their own thoughts and emotions, and to see them in perspective. Some people mentioned that talking to Wysa helped them to improve their self-esteem, feel more optimistic, and regain a sense of control over their lives. To be honest, people also suggested improvements. Some people asked Wysa to talk more naturally, others asked for more advice, and some expressed a desire for longer conversations. Before finishing, I would like to share with you a map with all the countries where Wysa in Spanish has been used. In my opinion, this map shows the scalable character of this kind of solutions. One, same development, useful for people who speak different types of Spanish at the same time. And finally, I will share below a video with a demonstration of how Wysa works in Spanish, and I hope you enjoy it. Well, I hope you enjoyed the video. And before finishing, I want to tell you about the next steps for Wysa in Spanish. Currently, the MVP continues to be available to everyone who downloads Wysa in the 10 Spanish-speaking countries that is available. In addition, that this is a good news, we have made it to the final stage of a challenge organized by a Latin American investment fund, Impactus Ventures. And in case we win, we will be able to run a pilot in Mexico together with an NGO, Enseña por México, that is part of the Teach for All network. Global network. The aim of this challenge is to support the mental health care of parents of children aged 0 to 6 years so that they in turn can take better care of their children. And finally, in the medium term, our plan is to adapt a complete intervention program similar to the programs developed by Wysa in English. I hope you enjoyed the presentation and I want to thank you for listening. And of course, if anyone is interested in knowing more about Wysa in Spanish, you can write to me at the email address that appears in the slideshow, and I'll be happy to continue the conversation. See you soon.